MRI is currently the best evaluated imaging tool for prostate cancer diagnosis. There are a lot of studies evaluating this imaging tool, and the current recommendations are to do an MR before a repeat biopsy. When you do a randomized biopsy, it is negative. You have a persistent suspicion of having a patient with a prostate cancer. Usually you do a repeat biopsy a second time. And in this case, you will find cancer in 20 to 25% of cases. So these are diagnostically challenging patients. And here, if you use an imaging as an additional information to target the tumor, you can increase the detection rate and you can increase the diagnostic reliability of your diagnostic workup. And here, several studies showed that if you use MR in this situation, you will increase the detection rate, you will have a better diagnostic workup of the patient relative to a repeat randomized biopsy. Having said this, and having the evidence that in a repeat biopsy setting it might be of interest to do the same approach in the first biopsy. Start up with an imaging approach. The problem here is that the current studies we have do not show a higher detection rate with an MR targeted approach if you would only go for a targeted biopsy and not do a randomized biopsy. And if you would only do a targeted biopsy in this situation, you risk to miss cancers, which would only be detected with randomized biopsy. So there's a controversy, and there's definitely no consensus if we only can go for a targeted biopsy with an MR at the first biopsy setting, or if we only do a randomized biopsy, or if we maybe combine both together. So it is clear that we should use MR for the second biopsy, for the repeat biopsy. There's a controversy and no consensus regarding the use of MR at the time point of the first biopsy.